Do you ever feel like you just don't have the time to sit down and read the news every morning? Sometimes things get so hectic you can't even scroll through your feeds while you're trying to get ready. A new podcast from Boise State Public Radio has you covered. I'm George Prentice, and I want to invite you to check out The Connector every weekday morning. You can get up to speed on all of the Idaho news you need to start your day without ever interrupting your morning routine. All you have to do is hit play. That's The Connector from Boise State Public Radio. Find it wherever you get your podcasts.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Every year, the world produces more than 400 million tons of plastic waste, which has made its way into our landscapes, our oceans, our air, even our bodies. And while it's easy to see the impact that this pollution is having on our environment, its impact on our health can be a little less obvious. That's why Dr. Phil Landrigan, a pediatrician and leading expert in environmental health, will be taking an in-depth look at this issue as part of St. Luke's Climate and Health Series. And he is joining us now to talk more. Welcome to the program.
Thank you, Hannah. Good to be here.
So can you start by giving us a little bit of history about plastics and how much plastic production has grown over the last 70 years?
Yeah, so plastics really came on the scene after World War II. There was some minimal use of plastics before that time, but it was really in the 1950s that plastics took off. And at that time, around the world, we were making between 1.5 and 2 tons of plastic per year. Today, we're making more than 450 million tons of plastic per year. So plastic production has grown more than 250-fold in 75 years. It's accelerating. It's on track to double again by 2040 and to triple by 2060.
So how are microplastics actually getting into our bodies?
Well, microplastics are invisible plastics that are formed when plastic breaks down in the environment. And once the microplastics are in the environment, in water, in air, they can get into the food chain and they can get into people. And the two principal ways that these invisible particles get into us is through our food and through inhalation of airborne particles.
So what pollutions are most vulnerable to these microplastics and this chemical exposure?
Well, I think we're all exposed to these things. I don't think any of us are immune or without exposure. But the people who are most vulnerable are pregnant women and young children, because when you have to understand that microplastic particles contain thousands of chemicals. They have all of the toxic chemicals that are in plastics. And when those microplastic particles get into the body of a pregnant woman or a young child, the chemicals that are in the particle leach out, they get into the bloodstream, and they can cause damage to the different organs in the body.
And let's talk about children. How do these plastics impact our kids?
Well, in several ways. The most dangerous exposures are prenatal exposures. When a mom gets exposed during pregnancy to plastics and any of the chemicals that are in plastics, those chemicals go through into her baby, get into the baby's circulation. And prenatal exposure is linked to increased rates of low birth weight, increased rates of premature birth, even increased rates of stillbirth, and then various chemicals that are in the plastic that leach into the child's blood can have negative effects. So, for example, phthalates, which is a class of chemicals very widely used in plastic, can cause birth defects of the reproductive organs in baby boys. And bisphenol A, which is another widely used plastic, can cause liver damage, which in turn elevates the levels of cholesterol and other lipids in the bloodstream. And that leads to increased rates of obesity, increased rates of diabetes, and not so much in childhood, but in later life, increased risk of heart disease and stroke.
So is there any way to get these plastics out of our bodies once they're in there?
Not really. No, they're really, as far as I know, and as far as medical science is aware, there's no way to get these chemicals out of the human body. So the only way to reduce the harms to health is to reduce exposure to plastics. And there are various practical steps that people can take to reduce their plastics exposure. So, for example, minimize the use of plastic containers to store food. Whenever you can, put stored food into cans or into glass. Never microwave in plastic, even if it says microwavable. Don't do it. Take the food out of the packet and put it into glass or ceramic. And the reason I say that is that when you microwave food in plastics, the energy from the microwave drives chemicals out of the plastic into the food and increases your exposure. And then people can work collectively through the society. Different cities and towns across the United States have banned plastic bags. Schools and colleges are beginning to ban plastic knives and forks and spoons and plates, and going back to paper or even to washable plates and washable silverware. The plastic has invaded our lives over the past 40 years, but many of the products are not necessary. Some plastic products are absolutely necessary. As a medical doctor, I couldn't practice medicine without plastic intravenous tubing, laryngoscopes, other instruments. But a lot of plastic is unnecessary, and I think we could all learn to live with less plastic in our lives to retain the plastics that are essential, but reduce our use of the plastics that are not essential and not really needed.
So is this why those examples you gave, is this why we are seeing chemical and plastic pollution increasing so rapidly?
Well, I think the reason that chemical production is increasing so rapidly, and basically when you increase production, you increase pollution. The reason it's going up so rapidly is that, number one, you have to understand that 99% of plastics are made from fossil fuels, from gas, from oil, from coal. And production of gas and coal and oil is going up, up, up. The United States is now the world's largest producer of gas and oil, thanks to fracking. So on the one hand, you have an enormous amount of feedstock in the hands of the big fossil fuel companies. And at the same time, they see the market for gasoline, for diesel, going down because people are switching slowly, but definitely switching to renewables, green cars, solar panels on the roof, and so on. So they say to themselves, okay, we've got all this gas, we've got all this oil. 10 years from now, people are not going to be burning so much of the stuff. What can we do with it? And the answer they've come up with is to divert more and more gas and oil into plastics. And I think that's what's driving the big increase that we're seeing.
So if we continue on the track we're on today, I'm going to assume, as you mentioned in the beginning of our conversation, we are just going to see even more plastic production over the next few decades.
Yeah, twice as much by 2040 and 3 times as much by 2060. There'll be plastic waste everywhere. Yeah.
So, do we have any idea yet of what the long-term impacts of these microplastics might have on our bodies?
Well, the information is beginning to come out. It's certainly not complete, but we're getting there. And we first of all, we know that a number of the chemicals in the microplastics are very toxic. I mentioned that bisphenol A can cause negative effects on the health of infants and children. It can also, there's emerging evidence that it reduces fertility in adult males. Sorry, I said that wrong. That phthalates reduce fertility in adult males. Bisphenol A in adults increases rates of heart disease and stroke. And we have done some calculations indicating that many thousands of deaths each year in the United States can be attributed to these plastic chemicals. Also, there was a big paper published in March of 2024, 9 months ago, in the New England Journal of Medicine on microplastics. A group of cardiologists working in Europe found that if a person has microplastic particles in their blood vessels, in the wall of their blood vessel, they are 4 times more likely to die in the next 3 years of heart disease or stroke. So that's a striking finding. It's only one study, It certainly needs to be replicated before it can be taken as proven fact. But it's a striking finding, and it demands that we pay attention and begin to think about ways that we can reduce our exposure to plastics.
Do you think we've reached a tipping point with plastic pollution? I mean, is there time to still turn things around?
Yeah, I think there's always time to turn things around. I'm not a person who gives up hope. Um, the United Nations is now taking plastics very seriously, and you may know that the UN has a global plastics treaty in negotiation even as we speak, and it's been hard going. Some of the countries like Saudi Arabia and Russia that produce great amounts of oil don't want a good treaty to go forward. But still, the work is proceeding, and I think when the negotiations are done, we're going to have a global plastics treaty that pushes the world in the right direction.
So, what about on a larger scale? Can you talk to us a bit about the global plastic treaty that you just mentioned and how that could possibly start changing things?
Well, a treaty will be most effective and it'll be most protective of human health, most effective of children's health, if the central feature of the treaty is a global cap on the production of new plastic. Right now, there are no constraints whatsoever on plastic production. It's just going up year to year to year. And the first step in slowing things down, getting a handle on the problem, reducing harms to human health is to impose a production cap. And then the second key provision that needs to be in the treaty is that there needs to be regulation of all the thousands of chemicals that are in plastics. Right now, if a chemical industry wants to put a particular chemical into plastic to make the plastic flexible, to make it fire resistant, to make it water resistant, there's nobody at all checking those chemicals to see if they're toxic or not. And the consequence is that all of us, and especially children, are being exposed to toxic chemicals every day. And a group of us, we actually convened a conference at my home institution at Boston College in October of 2024. We brought together a number of scientists who are studying the plastic problem with a number of ethicists and theologians. We had Protestant theologians, Eastern Orthodox, a rabbi, some Roman Catholic theologians. And the conclusion that the conference reached is that current trends in plastic production, the current reckless, unchecked increase in plastic production is fundamentally immoral because it's contaminating God's earth. The chemicals are getting into unborn children in the womb, and we just need to do something to slow this down and get it under control. And as I said a few minutes ago, it'll be important to retain the uses of the plastics that are really important in modern society, but cut back and even get rid of the unnecessary, pointless plastics.
So before I let you go, we just talked about this global scale, but what can be done to reduce plastic pollution on an individual level?
Well, I think individual consumers have a lot of power here. So people can get away from plastic shopping bags, bring a cloth bag or a paper bag to the store. Cities and towns can ban the use of plastic bags. Whole countries have banned plastic bags, including some African countries like Kenya and Rwanda, and they've cut their plastic pollution way down. If countries in Africa can do it, we can do it. Also, schools, universities, hospitals don't need to use plastic plates in the dining room. They don't need to use plastic knives, forks, and spoons. It was only a few years ago that hospitals used glass dishes and metal cutlery. They can go back to it. And yes, there's a bit more cost to dishwashing, but on the other hand, they will greatly reduce their waste costs and they'll greatly reduce the impact of the healthcare system on the global environment if they cut back their use of plastics.
Well, I want to thank you so very much for the conversation. We've been speaking with Dr. Phil Landrigan, a pediatrician and leading expert in environmental health, about the impact of plastics on our health. He'll be talking more about this issue on January 8th as part of St. Luke's Climate and Health Series. You've been listening to Idaho Matters from Boise State Public Radio. I'm Gemma Gaudette.
If you like podcasts like this, explore more from the Boise State Public Radio podcast family. There you'll find a mix of daily news, Idaho Voices, and in-depth series on a wide range of topics. I'm talking wild horses, political scandals, sustainable ranching, and militia groups in a post-January 6th world. Wherever you get your podcasts, just search Boise State Public Radio to find what Idaho's NPR station has in store for you.